U.S. Health Secretary Alex Azar is on a high-profile visit to Taiwan. He's the highest-ranking U.S. official to visit Taiwan since 1979. And here with me to talk about this landmark visit is the president of National Yang Ming University, Dr. Steve Guo. Now, Dr. Guo is also the former Director General of the Centers for Disease Control and has worked extensively with the United States in bilateral health ties. So thank you so much for coming to our studio.
I'm happy to be here.
Yeah. Well, tell me, first of all, what do you think the main purpose of Health Secretary Azar's visit is to Taiwan?
Right. Obviously, it's multiple purpose, right? It's not only for the health cooperation bilaterally, but I think it's both for the geopolitical purpose and probably for some domestic politics as well. Yeah.
Can you elaborate on what you think is trying to achieve?
I think for the collaboration on the health side, if they can sit on and talk, then they really can kind of open up a door for the working levels to do more. So I think it's very important for the both countries on the pandemic control the measures collaborations. But I think also is obviously, I think it's a strong signal from the Washingtons to show the world and also for its people that they want to have a very strong support for Taiwan, not only for health security, but in general security as well. So I think it's basically is very good for Taiwan. And I guess people will say it's also it's a way of President Trump to show is different from all his predecessors, that he doesn't fear CCP of China, right? You know, in the past, never before, there's a president of United States dare to send a high-ranking officers like Secretary of Health to come to Taiwan to spend 4 days, not 1 day. You have to understand, you know, for a busy health secretary to spend 4 days in Taiwan, it meant a lot. And so I think it must be multiple purpose. Yeah.
And also, I mean, he's running for re-election in
Definitely.
November, and he's not doing so well in the polls. So
Right.
do you think that this is also a way to maybe rallies opposition against China or change the focus of, you know, domestic attention?
Yeah, I think obviously, you know, I'm not a political scientist, but I think even as amateurs, I can tell that that is one of the President Trump intentions to do so. But I think by doing so is not bad for Taiwan as well. I would say that, you know, put Taiwan on the hotspot, but also it gives Taiwan more publicity. As you may know that for an educated American, they know the difference between Taiwan and China. But for average American, many American people doesn't really know where's Taiwan and what's the difference between the Taiwan and China. And so for that purpose, I think it worked very well. I think it raised the profile of Taiwan. Hopefully not really kind of irritate CCP too much.
Well, they have a very good excuse to be here.
Right.
Because they have a major pandemic that they're dealing with. I mean, they have over 5 million cases right now.
Sure.
And Taiwan has contained the pandemic very well. Are you surprised with how bad it has gotten in the U.S.?
Yeah, well, yes, I did. Yeah, I was very surprised in some degree because I've been working with U.S. CDC for many, many years. And actually, we learned a lot from the U.S. CDC. You know, remember the SARS outbreak in 2003? Actually, during that period of time, U.S. sent altogether 36 experts in Taiwan.
Wow.
At that time, I was the coordinator of the Taiwan SARS outbreak, so I know very well about, you know, how they did things. So during that period of time, so we learned a lot from the U.S. Experts. And so, you know, to some degree, they are the best in terms of the preventing and controlling pandemic in a sense. But just unfortunately, I mean, I would say, is bad luck to some degree. It happened at a time when you have a general election coming. Okay, when the president felt kind of threatened that he might lose the elections, and so all the parties, play in exactly like 2003 when we have the SARS outbreak. That was the 1 year before the general elections, so we have that experience as well. I mean, so. To some degree, I think they can do better. But much has been said about why the U.S. didn't did well. Maybe the leadership, maybe the cultures, maybe other things, including a mistake of the testing in the early on by the U.S. CDC and that sort of thing. But I would say, I mean, they will overcome. I'm pretty sure. And also, I know that during last couple of years, the funding for the U.S. CDC has been cut significantly. And so maybe they can learn the lesson at this time and move on. So yes, they should be do a lot better than what we saw here. Yeah. So yes, I'm quite surprised to some degree. Yeah.
So what do you think that the U.S. needs to learn from Taiwan, or needs to do in general to contain the pandemic in the U.S.?
Yeah. Well, I've been asked this question many times. I don't try to be kind of humble or polite, but really, there probably not much that the U.S. can learn because the big difference, in terms of the government structures and the culture, the people's attitudes to individual freedoms. Having said that, I will say one thing. During the SARS outbreak of 2003, we learned that the major infectious disease outbreak is need to be treated as a national security. So before that, actually, Taiwan political figures don't believe that. But after the SARS outbreak, everyone, I mean, they will understand that infectious disease is truly a national security. Let alone the pandemic like this. And so, if you treat it as a national security, then you need to centralize the command and control. It's probably difficult in the United States, but remember, U.S. has been done this before. Right after 9/11, actually, because of the fear of anthrax attack, actually, U.S. do a pretty good job. Try to some degree centralize the command. So the system won't be fragmented as we have seen recently. And so that is one thing they can learn. And I know there are probably people are talking about how to change the command system, after this outbreak. And so they can get better prepared for the next pandemic. And also, the National Health Insurance Program here in Taiwan worked very well for controlling and preventing the pandemic like this ones. And I don't think the U.S. can copy the single-payer system to the U.S. I don't think so. But they still can create some infrastructure so the people information can link together. So in a crisis like this, they can have a better tracking system for people. And so I think they are thinking about that, I know. From the discussions with my friends in the U.S., they have been thinking that for quite some time. And I think there's not much things they can learn, but I think they certainly help the U.S. government and the health professional to rethink their strategy and the healthcare system for better reform down the road. Yeah.
Well, they recently signed an MOU, the two health ministers of Taiwan and the U.S. What do you think this MOU is going to do in terms of bilateral cooperation?
I think I didn't go through the details, but I do read some of the report and about the MOU, and it's kind of a general umbrella ones, nothing really kind of a specific. So some of the people is criticizing that it's kind of anti. They should do more, and for instance, just promise Taiwan for some degree and some amount of the vaccine, something like that. I know people are thinking about that and do have not very satisfied about this lack of concrete promise. But I think as a former health attaché in Washington, D.C. for many years, I think that's good enough because by visiting Taiwan for 4 days, formally sign an MOU really kind of opened the door for the working level. I mean, the the Taiwan CDC and the U.S. CDC, the FDA, they can continue to work on the details. Okay. So now, as everybody knows, the Secretary Azar is here, and he actually very sincerely hope to improve and to enhance the bilateral relationships. And so there's more we can do. I would say instead of getting a vaccine from the U.S., I would say it's probably more important that we can create a common regulatory pathway for vaccine development. So the vaccine company here in Taiwan or the company in the U.S., they can follow the same regulatory pathway to get the market approval. That will save a lot of time. And as you may know, that is actually we now have 3 vaccine company, and one of them called Moderna actually has been working with the U.S. NIH for many years.
So what do you know about the outlook for vaccine, whether coming from Taiwan or the U.S. For the coronavirus?
Well, actually, as everybody knows, that the U.S. has, under the President Trump's plan, they are trying to obtain doses more than they can use, and from multiple sources, right? And so as a kind of insurance, right? And so they are doing very well. I think the phase 1 and phase 2 trial from the leading company called the Moderna proves very good. Not perfect, but is acceptable. And they are continuing to do the phase 3 clinical trials. Here in Taiwan, we are looking behind a little bit, but we are begin to do the phase 1 study. And interesting to know, actually, the Moderna company here in Taiwan actually have the same origin of the vaccine, okay, from the NIH. So once the U.S. prove the Moderna vaccines is workable, to some degree, it would suggest that our vaccine in Taiwan could work equally well. So that's good news. And so basically, I don't think, although we are lagging behind a little bit, but I think they are doing their best.
So what do you predict in terms of how fast the vaccine is going to come out and how it will help contain this pandemic worldwide?
Well, vaccine is the most important things right now, because without the vaccine, I don't think there's an easy way to end the pandemic. Okay, and the earliest possible safe vaccine become available, in my mind, that would be the early spring next year. Okay, maybe later, but I think it's possibly in next spring we will have the vaccines. Now, I know some people will say, in the end of the year, the winters, there will be vaccine available, but I would say that's only for emergency use only. Okay, so we are doing things differently this times, which means that in the past, all the vaccine developers, they will try the vaccines and until it prove it totally safe and effective, then they started to produce. Now this time is different. They actually begin to produce mass quantity. At the same time, they are still testing the vaccine. Okay, so it's become a parallel. Okay, so in my mind, I think next year, sooner or later, we will get the vaccine.
Well, we hope very soon, right?
Right.
Well, going back to Health Minister Azar's visit, what do you think is the biggest benefit for the U.S. and Taiwan, and what do you think? What do you hope to come out of this visit?
Well, actually, I think it definitely brings the two countries closer. Okay, spending 4 days in Taiwan for Secretary of Health U.S. Really shows something. Ordinary people doesn't know that, but I know very well. I mean, usually when a Secretary of Health travel to Geneva for a World Health Assembly, the average time is 2 or 3 days.
Really?
Yeah. So because
he's just too busy, or what is it?
He's a busy guy, and they are doing things like every 10 minutes, meeting people, and then right. So I mean, by spending 4 days in Taiwan, show is really their goodwill. Try to making friends with Taiwan, and I think that's good for Taiwan, no doubt about that. If we have a pool right now, I'm pretty sure that probably 70% of Taiwan people will say they appreciate his trip. And so that is in this kind of friendship level. And certainly, like I say, I mean, there's have a specific talk between Secretary Azar and the Minister Chen, but also there's a working level discussion going on as well. So they will bring the two countries, even the health system experts, even closer, right? Yeah, and for the U.S., like you suggest, that certainly President Trump is now in the election campaign, and so he needs to do something to differentiate himself with other candidates, and to show that he is not afraid of CCP, right? And so, for that reason, I think is I think we need to give him the credit. I mean, for many years, we have the sheer value of democracy, and now it's become clear that CCP to some degree is a authoritarian natures, and truly, cannot be totally trusted. Yeah, and we need to change a little bit our strategy, and so it's also a lesson for us as well, right? So I would say it's both good for Taiwan and for the U.S.
Great. Yeah. Well, thank you so much, Dr. Guo, for joining us today. I've been speaking with Dr. Steve Guo. He's the president of National Yang Ming University, also the former director of the Centers for Disease Control in Taiwan. Thanks for tuning in. I'm Natalie So.